Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I am your host, Stephanie Zwonitzer, and we have with us today Dr. Melissa Donahue. She is a sex therapist. She is a licensed clinical social worker and a certified sex therapist. She is a supervisor with a private practice in Ridgewood, New Jersey. She is also a partner in the New Jersey Center for Sexual Wellness and an adjunct professor at Montclair State University. She focuses on the mind-body connection as she works with individuals and couples experiencing disconnection in their relationship and sexual challenges. Her therapeutic style is goal-oriented, focusing on increasing pleasure and enhancing communication in relationships. So welcome.
Thank you for having me.
Absolutely. So you've been a sex therapist for how long now?
Been a certified sex therapist since 2009, I believe, is around the time the certification went through. But as my supervisor at the time told me when I was going through the certification process, I've been a sex therapist for a lot longer, just not realizing it.
Yeah. The certification comes later, but you're doing the job already.
Right.
Yeah, for sure. So we had talked prior to this episode, and we wanted to kind of hone in on a couple issues that really I see a lot in my practice as a urologist, and I definitely am sending my patients to a sex therapist when I can. So I kind of want my listeners to hear from your perspective, because they've certainly heard my perspective on things. So let's start with erectile dysfunction. If I have a guy coming in and I just really don't think it's physiological, or maybe it's partially physiological, but I can tell that there's more to it. You know, he's been through a bad relationship or going through financial struggles, things like that. And I'm like, hey, you should go see this sex therapist. What's your take when they come to you? How do you work through that? What are you seeing when they come to you?
Well, when patients first come to me, I want to make sure that I do a complete biopsychosocial and a sexual history with them. I want to get some detailed information of what informed them growing up about sex, what messages they got culturally, religiously, ethnically, because different communities give different information.
Yeah.
So that's the first place that I want to start. I also want to understand who gave them the sexual messages that they learned in school, their friends, their families. Because that's important where they got their messages from and how accurate the information was. You know, if we're talking that your sexual information is coming from teenagers with no lived experience about sex and taking the information, I say, off the streets and stuff, it's not accurate always. And there's lots of myths that go around that don't really apply.
Yeah.
And then I also want to understand. Yeah.
I'm learning that firsthand right now. I have a 16-year-old son. He's almost 17, and him and his buddies come over and they'll tell me things that they think about sex or, things that I'm just like, where did you learn that? Like, let's have a conversation, guys.
Yes. I remember being a teenager myself and hearing if you stood up after sex, you couldn't get pregnant, or if you had sex in the shower, you couldn't get pregnant. I think there were some other things about using Coca-Cola internally to kill the sperm. I mean, the things that people teach them. And what's scary is that those messages live on in adults still to this day.
Yep.
But I think it's important to understand all that information, because when we learn where people get their information, how it infuses into them and their past relationships, it gives you a better picture of what they're going through.
Sure.
You know, if you think about how education about sex was shared primarily probably decades ago, it's changed and shifted a lot, especially in the area that I'm in now in New Jersey. But it used to be for the reproductive model. Yeah. So if sex is taught through the reproductive model, then there's no space for women's pleasure or women's experience of orgasm. It's male ejaculates inside woman, and it also doesn't allow space for people who are in same-sex relationships.
Sure. Or just an intimacy level outside of procreation.
Right. So if we're thinking that we have to have an erection and we need to be able to penetrate something, that's our only lens of sex, well, we're already starting up with a problem, because as men age, we know that their erections may not be as firm, similar to what women go through with menopause and their changes in their body. And also we know that their refractory period changes and shifts too, which sometimes people misunderstand as erectile dysfunction. Sometimes it's just really erectile dissatisfaction or disappointment.
Sure. And for the listeners, if you don't know what a refractory period, it's your ability of time to get the erection again after you've climaxed. So when you're younger, I mean, that's just rapid fire. These teenage boys can get erections very rapidly. They can orgasm again very rapidly. But as you get older, that timeline gets longer naturally. It's not a problem. It just
Yes.
naturally gets longer.
And for a lot of men, that's very disappointing,
Mm-hmm.
especially if they're self-pleasuring and then they're with their partner and they can't perform the way they want
Right.
to.
Yep.
So I think, knowing all that information, but then also making sure we know who their partner
Mm-hmm.
is key, because how their partner responds to the way their body responds matters
Right.
on whether or not this really is an erectile issue or not.
Right. Milo likes to say hi.
Pets love to be on camera.
They do. And he just absolutely loves his mama. And so he gets to sit on my lap. So, yeah, I mean, I think you're right. And especially with so many people going through divorces and dating later in life, and then all of a sudden they're having issues that maybe they didn't have when they were married because they've been single for a couple years now. And so they're a little bit older. The things are different. The anxiety of pleasing someone new. I'm sure all of those things play in.
I mean, if you think about what you created in a previous relationship, think there are certain things that people do in relationships that work fine, whether it's penetrative sex or not. You work around certain challenges with each other's bodies. And then when you go out in the free market to start dating again, whether you lose your spouse to, a termination in a marriage or a death, you go back out in the free market and what's worked in your relationship before has worked that way, but you go out and people are now shaming you and blaming you for why can't you do this and why can't you do that. It really gets in people's heads. And, one failed attempt with a hostile, bed partner gets people in their head. And it takes a while to undo that, because now we have people who are micromanaging their function of their penis.
Right.
And we know that the penis does not like to be micromanaged. It knows its job. Right. And once you start micromanaging it, it's like a toddler having a temper tantrum. Well, then I'm not going to perform. They're going to be looking at me saying, are you going to stay hard? Are you going to focus? I'm going to be soft. I'm not going to play.
Right. Right. I tell my guys all the time, their head-to-head connection is extremely strong, and their ability to be so anxious because last time they lost their erection, and are they going to lose it this time? Or is this new partner going to like what they do? Is their size the right size for this partner? All of those things play into their ability to get a good quality erection.
Yeah. And I think it also is the quality of their partner. You have a partner who's not supportive or kind or gentle with that, the penis doesn't want to play with someone who's mean to them.
Correct. Absolutely. And for some of the guys, as they're coming in, if I'm thinking as a clinician that this is kind of sounding a little bit more on the psychological side, they wake up with morning erections, they can get an erection with masturbation. So it's not physiological, that's more on the mental side. And so, even though I know I'm going to send them to a sex therapist, sometimes I will give them a little low dose of Viagra or Cialis just for that confidence boost, for that ability that I know I've got something on board that can help me here. And I find that a lot of times, if they do actually go to a therapist and they're having that little boost of confidence with the medicine, that we're able to kind of get them to overcome it. And it doesn't, if it's not physiological as well, they're not necessarily bound to being on medicine for a long time. It just kind of helps them get over that hump.
Yeah, it's interesting. I have some patients that have come who've gotten the boost. And what I found is that they will use it for a long time before they see the therapist.
Mm-hmm.
And then they'll say, well, it stopped working.
Yeah.
And I'll say, well, it wasn't meant to be a forever, pill. It was meant to help initially for you to then get to the appointment, depending on how long it took for the schedules to align.
Right. Right. Yeah. And I think, it's one of those things that you really have to get buy-in from the patient, because a lot of them, especially men, I find, think that they're weak if they go to therapy, or that they haven't done something right, because why should I need a therapist? This should just work. It's my body part. And kind of breaking through that stereotype and that stigma associated with going to therapy, because once they go, they're amazed and they love it, and they really have leaps and bounds of growth.
Right. I mean, I like to tell patients, if you hurt your shoulder or had hip surgery or any body part was broken and you need physical therapy, would you say that you're too masculine, you should just get over it? No, you go for mobility purposes, for quality of life. It's the same thing for mental health therapy.
Yeah. Absolutely. Absolutely. I know I love my therapist. Okay, so are there any other like big things that the guys come in before we transfer to the women?
So I think the important thing is to realize that you don't necessarily need an erect penis for sexual pleasure
Mhm.
and fulfillment.
Yeah,
We don't need to necessarily be penetrating things with our penis.
agreed.
So if we can take the penis and what it does and kind of put it to the side
Mhm.
and realize that, your skin is your largest organ
Yeah.
and focus on that, it's amazing on the quality and pleasure of sex that you can have without penetrating. There's so many items on the menu. It's like,
Mhm.
going to a diner and only getting the same thing every time. Like there are
Right.
options that you've never tried. And once you explore that, maybe penetration is not your favorite.
Yeah. Yeah, I have this conversation a lot with my post-prostatectomy guys who are in that phase of it's just not back yet. And most of them get the function back, some don't, but that's a conversation that I have with them. And I love it when their partners are in the office as well. And I can be like, you guys have so many other ways to be intimate together. It doesn't have to be penetrative sex. And if that's something that you like, then we get the sexual wellness tools involved and you can have your partner penetrate you even if it's not with themselves. I have some gentlemen who are very open to that because they
Hmm.
want to please their partner. And for them, that is a part of what they want. And
Right.
so they will get a strap on dildo or they will get a dildo they can use with their hand or something along those lines and really bring pleasure to their partner, even though they aren't the one penetrating. And it's a beautiful thing when you're connected enough with your partner to have those conversations and to take the embarrassment and all of that out of it and just be able to find what is your new normal and what's going to work for you.
Right. I think the challenge is that a lot of men internalize if my body can't physically
Mhm.
do this, then therefore I'm less than. And the reality is that if your partner is experiencing pleasure with you
Mhm.
in whatever the capacity is, even if you're just in the room with them,
Right.
that's a connection right there. It doesn't have to be your body parts
Right.
creating the pleasure. You could just be a
Absolutely.
witness of sometimes.
Yeah. Absolutely. I think that's a huge factor for a lot of them.
Hmm.
And encouraging their partner too, because, we know as a society, women don't masturbate as much as men do because there's more of a stigma for women doing it. And if you can encourage your partner to do that and how much maybe that turns you on by knowing they're getting pleasure or watching them get pleasure, that can be a whole nother level of intimacy.
Yeah.
Yeah, absolutely. Absolutely. So what are some of the things that women are coming into you, for to increase their sexual activity, their sexual health and enjoyment?
Well, I think there's a lot of women that are coming in because number one, they've never had an orgasm by
Mhm.
themselves or with a partner, or they've never had an orgasm with their partner.
Yeah.
And for some, it's their concern that it's never
Mhm.
happened. And for others, it's the concern of their partners. And, we need to go over the educational aspect of not all women can
Mhm.
have an orgasm with just penis inside vagina only.
Yeah. Absolutely.
And it's interesting because, when you bring the male partner in, they'll say, well, all my previous partners had them. I'm like, well, that's fine.
Yeah.
Perhaps, if they were honest, perhaps.
Right.
Or
Exactly.
or maybe they're the lucky one third of the population that your bodies happen to align properly for, because
Right.
it really is about anatomy and how things line up and how aroused
Mhm.
people are, positions. There's so many factors involved.
Yes, absolutely. And I think a lot of men specifically don't understand how long it takes a woman to get the proper arousal to even be able to achieve orgasm. I mean, physiologically, it takes women 14 to 20 minutes to get all that blood flow and the
Mhm.
lubrication and all of the things going to be able to achieve the orgasm. And then you get on top of do they do it clitorally or penetratively or all of those things. But if you're not stimulating your partner for a while, and then just expecting her to have an orgasm and feeling bad that she doesn't, that's a problem.
Yeah, there's a lot of people who seem to think that women are like race cars,
Mhm.
males. I think they're like race
Mhm.
cars and then could just press a button on their shoulder and they're aroused and they just start
Yeah.
oozing, vaginal fluid
Right.
and they're
Right.
ready to go. And I'm like, no, maybe you're a race car, the men, and the
Yep.
women are like classic cars. You need to turn them on. The
Right.
engine needs to sit a bit before you're going to go cruising down the highway.
That's right. Yeah, and that's a great analogy because a lot of men relate to cars. So
Yes.
that's a great analogy. Yeah. And I think that that's so important, especially in our heterosexual relationships, right? Because women who are in partnerships with other women, they get it because they both need that extra time. They both need
Hmm.
that emotional and physical part and all of that. Whereas when you have, you bring a male in who doesn't necessarily understand the female psyche quite as well, then you're trying to, over bridge that gap.
Right. And you find out, the other aspect is whether they're not understanding the body, they're not giving
Hmm.
ample time for women to decompress before they get aroused.
Right.
If you're leaving sex to the last thing on the list of the day,
Yeah.
I always tell women when your teeth brushing comes ahead of sex and you're in bed exhausted after being,
Yep.
whether you're working in the home or out of the home or both,
Yep.
caring for other humans, animals, whatever, and coming to bed and exhausted, and then your partner rolls over and starts nudging you, it's not going to work well. You need to
Yeah.
reconfigure your day and time so you do have the ability to enjoy it and have the time to decompress and then get aroused.
Right.
There's a period of time. Like quickies can happen,
Yeah.
but not right when you're about to fall asleep at night.
Right. Right.
At least
Yeah.
not
And that,
successfully.
right. Exactly. Exactly. Yeah. I've told my partner, I was like, if you want lazy sex, hit me right before bed. But if you want some good stuff, like get me like pre dinner.
Right. I always tell people like drive through sex versus like elegant dining.
Right. Exactly. Exactly. Yeah. There is a difference. And then that's another complication that we have because then some couples, their libidos don't match or the time of day that does arouse them doesn't match. So do you have couples that come in or do you just do individual? Like how do you help them manage that part?
So when I'm working with an individual, we either come in the office, we do Zoom, depending on what works best for their
Mhm.
schedules and their lifestyles. When I work with couples, I like to see them together the first
Yeah.
time, whether we do Zoom or here in my office. And I like to see how they interact together. And it
Mhm.
tells a lot about their relationship, how close they sit, if they touch, if they look at each other,
Sure.
their body language. And then I find it important to meet with each one of them individually to get their backstory. Because I
Mhm.
find that, couples share, people always say, oh, I share everything with my partner, which I'm sure is true, but they usually share like the tip of the iceberg of
Right.
the story. Like, oh yeah, I had a boyfriend, he was really bad to me. I'm like, okay. And that's the story that they tell. And then when I
Yeah.
come into therapy, they talk about how they were abused or they were assaulted or all the trauma that, and like, this would be helpful if their partner understood the backstory, but they don't usually
Sure.
share all that information, whether there's shame of previous terminations of pregnancies,
Yeah.
STIs, all hosts of things that people don't completely share with their partner. So I need
Yeah.
to know that so I don't re-traumatize them when we work together.
Right.
So I usually tell people it's a couple session for the first time, two individual sessions, and then we come back and start working together. But my focus is the couple is the client. So that way, if we need
Mhm.
to lean on one person to give them more education support, we can do that because my alliance is with the couple, not with each individual.
Yeah, I love that. I like that approach. It's really nice. So, for ladies who have had some abuse in their background or something, how do you kind of get them to open up to their partner and be able to enjoy sex again and want it?
So one of the wonderful trainings that I've been going through recently is EMDR training
Okay.
and learning to help patients with bilateral stimulation reprocess old feelings and emotions that are trapped in their body from past experiences.
Mhm.
And I'm finding some amazing work. A couple of sessions, 2, 3 sessions of EMDR has done phenomenal work to help people be able to move beyond their past experiences
Yeah.
and be able to trust their bodies, lean into their bodies, and feel safe with their partners again.
That's really cool. Yeah, I've heard
So
about this coming out and more therapists and clinicians getting on board with the EMDR and I've heard really good outcomes.
yeah, I referred out for so long, and I was like, I started thinking to myself, why am I referring out? I've got them right here. I have the rapport with them. Let me
Yeah,
learn because then we can use this as a bridge to whatever work we're doing. And
sure.
it's amazing the transformation. People are always skeptical when they first do it, and then they're like,
Mhm.
oh my gosh, I can't believe. People will say I've been in therapy for years for this, and I haven't done much movement, or I thought I did done as much as I could, and then they do EMDR, and they're like, I can't believe how much lighter I feel in my body. So
Mm.
it's transforming for a lot of people.
That's really cool. That's very cool. How about your ladies who just, maybe they're going through menopause, they're just going through changes as maybe sex is a little bit painful. How do you kind of help them negotiate those conversations with their partner and just the desire for themselves?
Well, the first thing I like to do is make sure that they have a OBGYN that is well trained in menopause.
Mm-hmm.
There are unfortunately not a lot because it's
Yep.
not a popular topic in,
Yeah.
medical training and residency. So I need to make sure that I hook them up with an appropriate provider that can give them
Hmm.
what they need to know and to be able to
Yeah.
understand how estrogen affects so many different touch points in the body, like over
Yeah.
30 touch points of the body
Yeah.
where you can, when you start seeing like high cholesterol bumps or the
Yep.
frozen shoulder, people have itchy ears, they're having
Yep.
trouble sleeping. I mean, there's so many things that people don't realize that they're having. Night sweats, even though they're not having day sweats,
Yep.
irritability, the weight gain that goes right to the middle, even though they changed absolutely nothing.
Right.
So, kind of giving them that education is the first point. Let's talk about
Yeah.
what's happening in your body and why it's happening. Let's hook you up with a provider that can assist you and can give you
Yeah.
suggestions. And then making sure we debunk some of the myths that you've heard in medicine for years that if you take hormone replacement, you would get breast cancer
Yes.
automatically.
Yes.
And I remember when that information came out because I was working in oncology. And I remember the discussion of all of the oncology nurses there
Hmm.
and how all of them were concerned because they were all on hormone replacement at
Yeah.
that time. And what does that mean for them?
Yeah.
So being able to re-educate them, put them in touch with whether they like social media or books or podcasts of people who are out and about who are very
Hmm.
outspoken about menopause and menopausal care
Yeah.
so they can understand this. And it's made a lot of difference in the quality of the lives. If you understand what you need, it's not just a little bit of lube. That doesn't do enough.
Right. 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 Yeah, and it's interesting because working in urology, I have a lot of women come in for new onset of frequency and urgency of urination, new onset of pain with sex, just general irritation of the vulvar area. And, then they're telling me, I had a lady the other day, well, you know what? All of a sudden in the last couple months, my blood pressure is really high and I can't sleep very well. Or I'll have people come in and tell me about the frozen shoulder or something. Yeah, you're in menopause and these are all menopause symptoms. And from my part, I can get you on the vaginal estrogen, but then I also need you to go see somebody if you want to be on the full hormone replacement therapy. So, but I see a huge improvement in women just with the vaginal estrogen that I can prescribe.
Yeah.
It's amazing. They don't have the frequency and urgency anymore. They don't have the pain with sex. They maybe aren't even needing as much lube anymore because they're self-lubricating again. And just they actually enjoy having sex again. And now we even have some products out that have a little bit of androgen in them to help with that desire and the libido. And so it's really amazing the difference. Even in a few months, I usually have these ladies come back after like 3 months of starting the estrogen, and it's life-changing for them.
Yeah. And the increase of the UTIs that women get and the
Yes.
lack of symptomatology that you find with every decade because of the lack of estrogen.
Yep.
I have a broad spectrum of patients that I see. And I had one patient who said she thought she had the flu. And she just, she couldn't get over the flu. She couldn't get over the
Yep.
flu. And she went to urgent care once because she just couldn't feel better.
Yeah.
And the doctor suggested a urine specimen. She's like, why would you do that? That doesn't make any sense. She had a UTI and a pretty
That's
advanced
crazy.
UTI. And I said to her, "You're lucky he found that,
Right.
because that could have progressed and you could have been hospitalized."
Yeah, absolutely. Yeah, the symptoms definitely change. We don't get the frequency, urgency, burning like we do in our 20s and 30s and maybe 40s. You're getting more cognitive changes. You're tired. Your muscles hurt. You are forgetful when you didn't normally forget something. Or if, my older ladies who are, having some dementia, it's the more forgetful than normal or something. But yeah, you're right. It's very different. And the vaginal estrogen, there's a couple of studies out there. One is 60%, one is 80%, that the reduction in postmenopausal UTIs just from using vaginal estrogen. No other changes, just that. And it's like, why would I not want to do that? It's safe. It doesn't increase your risk of cancer. I have women who are on active treatment for breast cancer that, I always check with their oncologist just in case. And they let us use it because it's so locally absorbed and it's just got so many benefits. It's amazing.
Right. Think about the amount of money we spend on hospitalizations for sepsis and UTIs because women don't use something localized for their, some estrogen localized. I mean, the deaths that don't need to occur because of a little bit of estrogen helping that situation.
Yeah. And we're living longer now.
Quality of life thing and a financial thing.
Absolutely. Absolutely. And with living, this wasn't an issue 100 years ago because women weren't living this long. We weren't living past menopause very long. And so we didn't know how badly we needed that estrogen. And so it's
Mhm.
amazing. And I'll have ladies come in who have heard the study from the early 2000s and it's going to kill me. And so they've never done anything. And now 15 years post menopause, they're having all these recurrent UTIs. And they're like, well, how come it's starting now? Because that's just the way it did it for you. It's not
Mhm.
necessarily going to happen within that first year of menopause because you still have a little bit of estrogen kicking around.
Yeah.
But the longer you go without estrogen, the more those symptoms are going to come up. Yeah. So that's one thing that I've found though too, that you've found, is that there just really aren't a lot of quality providers and clinicians that can do menopause care. It's one of the things that I am seeking certification in because I don't have a lot of people to refer my ladies to. And so not
Right.
that I want to take on the full hormone therapy, but I want to help them more and give them more ideas and figure out who to send them to. And it's very important and it's not talked about enough.
I find one of the other hidden physicians that you can tap into or specialists is endocrinology. So
Mm-hmm.
if you can't find OBGYNs that are willing to do it, some endocrinologists are really helpful.
Yeah.
And I always tell people, even if you don't have a thyroid or diabetes, endocrinology is your next best
Yeah.
approach because they understand the hormones and how they
Correct.
impact the body.
Yep.
But it's interesting because even the doctors that don't really understand it, some of the techniques that they're using just are not suitable. Putting
Mm-hmm.
women on birth control pills at 50 is not really what they need. It's
Right.
too much estrogen. We don't need
Yep.
that much estrogen in the body. What we need is something different. So
Yeah.
yeah, I mean, the referrals also is I find these doctors that are fabulous, and then they leave the practice, and I'm like searching for them on LinkedIn.
Yeah.
Where are you landing? Because I have
Right.
to send papers.
Right.
I feel like I'm a stalker now on LinkedIn looking for
Yeah.
doctors. Like I'm waiting for you to say your next practice that you left because you left
Right.
this one, and I need some
Yes.
people to find you.
And it's so funny because I feel that way about my sex therapist. Somebody will move to another state or stop doing it. Or, with COVID, people retired. And I'm like, I need
Yes.
you. Yeah, no, absolutely. How do you help women kind of overcome, they have a husband whose libido is higher than theirs. They don't want to lose their husband, of course, because of sex. But that does seem to be a big issue in marriages. How do you kind of help them work through that?
So the first thing I try to figure out is okay. So what is considered sex in their relationship?
Mm-hmm.
I make them really write down what sex is to make sure we understand what that is. Frequently for men, it's the answer is always penetration. And I say, okay, well, what if it was just oral sex?
Yeah.
What if it was hand stimulation? What if it was just a makeout session on the couch, but it didn't
Mm-hmm.
go through any penetration, there was no release? And you start dissecting what sex really is. Sometimes couples realize that they're actually more sexually active
Mm.
than they really thought before.
Yeah.
The other thing that's a challenge with that is that when there is a difference in desire, I find that women typically it's either yes or no.
Mm.
And I say to them, well, instead of yes or no, can we think of the idea of when your partner's approaching of the idea of maybe?
Yeah.
Because what happens
Okay.
is because it's a yes or a no, women put up this force field around them where they
Mm.
don't want to be touched, no hugging, no touching, no playfulness,
Yeah.
don't even look at me that way, don't come near
Yeah.
me, because they feel like if they let them in a little bit, then they have to go all the way through the
Right.
entire production.
Sure.
Right. So when we say, okay, let's take penetration off the menu
Yeah.
and allow more physical touch and more playfulness and kissing and hugging, people feel more connected and the urgency for
Mm.
intercourse decreases because what the challenge is that men are not getting touched unless they have penetrative sex.
Yeah.
So if men are only getting touched and they have penetrative sex, they're going to seek it out sometimes more.
Yeah.
And so when I tell people, well then stop, take that off the shelf
Okay.
and try to touch each other on a more regular basis and see if that urgency decreases or not.
That's a great tip. I think women by nature want to be touched more frequently, except for while I'm sleeping. Please don't touch me while I'm sleeping. But, I think for men, it's one of those stereotypes or stigmas in our society that men just don't really need as much touch as women do. And they do.
I think you start seeing that when boys start going through puberty,
Mm-hmm.
that boys start developing. So parents pull back. They don't touch their sons as much as they possibly touch their daughters, giving them
Yeah.
hugs and stuff. And because of that, boys stop getting that touch.
Mm.
So when there's an opportunity for physical touch with their peers,
Sure.
it feels amazing. So they
Yeah.
want more of it. And I'm not going to discount puberty and hormones and interest in sex. Like
Right.
that's there too. But if you can only get when somebody is sexual with you, well,
Yeah.
that's just going to feed the emotions with that and link that
Sure.
forever. So trying to keep, that sounds like keep your hands on your boys in the huggy
Yeah.
way and cuddle with them and give them that input that they need so they know that that can fulfill the touch feeling that people need.
I love that. That's really great. Yeah, that's interesting. And I see that in with my partner's love language is very much physical touch. And so it's something that I try frequently, just the walking by and putting your hand on their back or those kinds of things throughout the day too. And I do notice a difference in just how he carries himself and his mood throughout the day on a day where, we see each other more often and I can provide that touch for him versus if we haven't seen each other for a few days and then he comes in and he's just kind of grouchy and give him a couple little back rubs and he's good to go again.
Right. Men want to feel wanted just like women want to feel wanted. And when you fulfill that need of a desire and a want for your partner, even if you don't fulfill anything,
Yeah.
it really helps balance out the relationship and feel the connection that you're looking for.
Absolutely. Absolutely. And we've said already in this episode that intimacy doesn't have to be penetrative sex. I mean, touching your partner is a way to be intimate. It's lovely. Yeah. So if couples come in for non-sex related things, they're financial, they're arguing all the time, things like that, do you find that sex is a part of the problem as well? Or is it really kind of secondary to some of these other things?
Well, sex is what brings them in the door at my office.
Yeah.
There's always somebody disappointed, so sex brings them in the door, and then we have to unpack all the other problems that are impacting, sex. I like to say that sex is on the bottom, and everything is squishing the sex down. So if we can relieve some of the other tension, things can improve. I find that there are some men and women that when things are stressful with work, being a caregiver to aging parents, being a caregiver to children, financial problems, and people feel that burden and stress, their desire turns off because they're in survival mode.
Yeah.
You're right. Like if you're being chased by a tiger, prehistoric times, you're not going to say, oh, I'm horny right now. You're going to say, oh my gosh, I want to live. I need to quickly, I need to protect myself.
Yeah.
So when you're in that survival mode, the procreation is just not there because it's not viable.
Sure.
So we need to take care of those feelings and manage those so we can come out of survival mode. I think so many of us are walking through life in survival mode so much. And when you're in there, there's no space for pleasure. There's no space for that internal biological function.
Yeah. That makes a lot of sense. So in those situations, do you have your patients kind of table sex then too to work through the other issues without also complicating it with sex?
No, I just tell them that we're going to take penetration off the table. I say we're just going to stop doing penetration. But you can touch your partner, you can, kiss your partner. Sometimes we reintroduce the idea of exploring your partner's body just for a connection.
Yeah.
Just so they have that physical connection. I always tell couples, when in doubt, go back to the roots of what we teach people after they have a baby. For couples, what do the doctors say after delivery for bonding purposes for the oxytocin? It's skin to skin.
Yeah.
So I tell patients sleep naked.
Yeah.
And I get the women saying, "Oh, I'm cold in the winter. I can't sleep naked." All the women that are premenopausal say that, of course.
Yes. Yeah. None of the perimenopause or menopause ladies.
Right. But I tell people, I guarantee you will be warm enough under the blankets with your partner. Just give it a couple minutes and everything gets toasty warm under there.
Yeah.
But I always tell people if you can't, for shame purposes, and some people think it's, they have all their other issues related to being naked sleeping. I say, then go topless at least.
Yeah.
So at least there's a skin to skin component. So there's a connection. There's that skin to skin touch that feels really nice and bonding, even if you're not having penetrative sex.
Right. Right. Oh, I completely agree. I know when I haven't, been around my partner for a while that when we get to touch like that, it's so comforting and it feels so good.
Yeah.
Yeah. Oh, I love that. Yeah, I think, your point of just kind of taking that penetration off the table is so good. I love that, it encourages the couple to find other ways of intimacy and reconnection and things like that. And I think, obviously this is a sex podcast, so we love sex here, but there are times when we just need to take a break from the penetrative part of sex to, like you said, get back to basics and relearn our connection and our intimacy level. And what worked when we first got together, 10 years ago, 10 months ago, whatever, may not be working anymore. Your bodies change and evolve and your mental state changes and evolves. And your stimulation that you need might be different now.
I mean, when you're in a relationship for a long period of time, you forget what brought you together in the first place. When you're dating, everybody gets all fancy and clean and puts on their best of everything. Smells clean, looks clean.
Yep.
And that you go out to an event and you share the things that are most interesting about you. If you're spending time with your partner and you're talking about logistics and you're talking about house repairs and potty training, well, none of that's sexy. You would never go out to like a party or a bar or an event and talk about that when you're meeting someone for the first time, that you're potty training your toddler,
right?
Or that, you have to get a new roof because there's a leak. Like, nothing is sexy about that. That's not going to get someone in bed. But hearing about your amazing philanthropy, or that you're traveling, or that you guys got this great promotion, or I don't know, you got a puppy or something. Those things are kind of exciting and fun to hear about.
Right.
Not necessarily some of the grind that people experience on a day-to-day basis. So if couples aren't spending time leaning into things that are exciting, that are bonding, that link them together, it's really hard to go from doing the dishes, making school lunches, mopping the floor to, hey, you want to have sex? Like,
right.
How is that sexy at all? Right. There's no good transition at all there.
Yeah, I get that. And I've heard other people mention like maybe having like a quote unquote meeting of the minds for the week or whatever, so that you can talk about all the functionality stuff of your relationship and the potty training and the who's doing what this week and who needs to, so that when you do have, an evening that you can spend together or whatever, you've already talked about that stuff, so you can connect on, a more intimate level with more of the fun things.
Yeah, I suggest the couples on a daily basis, whether it's after the kids leave or before you start your day in the morning, it's better in the morning, or after the kids go to sleep, if you have children in your family, to sit down with your beverage of choice, coffee, tea, whatever, and sit down and talk about your highs and lows of your day. Not about anything related to the family or the children, but like, how did you show up in the world today? What were your successes? Where were your challenges? What do you want to do better? And share that with your partner, because I think very often we withhold because we're afraid to be vulnerable.
Sure.
And we don't all have days that win. There are plenty of days that there is not a winning situation. Sometimes I leave work and say, oh, I sucked today. Like, I didn't do anything that I wanted to do. I wasn't effective as I wanted to be. And some days I feel really proud of the work that I do. And I need to be able to share that with somebody, because in a private practice alone, it's not like you have colleagues that you can bounce ideas off very easily. You're a lone ship by yourself.
Right.
So, but you have to share those vulnerabilities and say, look, like I don't feel like I'm doing my best self today. I just need someone to say it's one moment in time. Like, you're going to be fine.
Yeah. Yeah. Oh, that's great. I like that the little daily check-in. I think that's awesome.
It doesn't take long, like 20 minutes or so, 10 minutes of each. I mean, how many wins and loses can you have in a 24-hour period? You're not awake that much, right? You're in work for like 10 hours a day max. I mean, unless you're really struggling and you're about to be like removed from your job.
Right. Yeah. Very true.
It shouldn't take that long to talk about. It's sort of something I implemented when my children first started going to school, their highs and lows for the day. Tell me, because I wanted to hear, not that they learned nothing. Well, tell me what you were great at today. Like, tell me some things that you wish you did differently. What do you hope for tomorrow? And it really encouraged the opening up. And, I started doing it with my husband too, because it was important. We're separated for a long period of the day. And we actually, in the beginning part of our marriage, were working opposite shifts. He would be working like a 9 to 5 job, and I was mostly working in the evenings because I was home with the children during the day.
Yeah.
So I would be leaving before he came home. We'd have a sitter there. He'd come home, put the kids to bed, and I would come home late at night. And we wouldn't see each other unless we talked at night. That was the only way to connect.
Yeah. Yeah. That's a tough situation to be in. And I'm sure many of the listeners can relate to that. And so that's a great tip, just having a few minutes each day. Any other last minute tips you want to give our listeners?
I think the thing that's important is, if something doesn't feel right in your body, if you're not sure about something, don't be too ashamed to ask or talk to somebody about. A lot of times people feel like they're the only one, they're the lone person. Like, I have a lot of women who can't have penetrative sex and feel like there's pain during intercourse, and they just think that it's part of it. But sex is not supposed to hurt. There's not supposed to be pain. And there's no shame in asking why this is happening or to get help, because there is things out there that can reverse that, whether it's, if you're before menopause, if there is a pelvic floor disorder, if there is, something else that's going on. If you tell somebody, it can be fixed. You don't have to wait years and decades before, being embarrassed or shameful. If something is wrong, tell somebody.
Right. Yeah, absolutely. That's such a great point. Oh, this was such a fantastic conversation
Yes.
today. I really appreciate having you on here. And
Thank you.
we'll put some links in the show notes so people can find you if they want to learn more about you and what you have to offer. And I just really appreciate you being on here.
Thank you so much for having me.
Absolutely. All right, everybody, have a great day. We'll see you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.